90% of FMD patients are women, and well, obviously that means that 10% are men, and so the information about men with FMD is not as robust as is the information of women with FMD, and for that reason, it's difficult. Again, understanding that the overall information about patients with FMD is limited to only several hundred patients, well, several thousand patients, I would say, internationally. Then, you know, to draw conclusions about the several hundred men that we know about with FMD from that would be difficult. I would say that at this time, we assess and we treat patients whether or not they're, you know, men or women similarly. Right. So here at Mass General, there's a wonderful collaboration between the SCAD clinic, the FMD clinic, and also, by the way, the vascular genetics service. And we've actually published on this last year. There's actually been a publication just this week in the Vascular Medicine Journal about the relationship between FMD and spontaneous coronary artery dissection, or SCAD. The prevalence of FMD amongst patients with SCAD, and by the way, amongst patients with cervical artery dissection, the prevalence is quite high. Now, we assume that if you find FMD in a patient in who had a SCAD event, we assume that the SCAD event was likely secondary to FMD. We also know that once you see the typical imaging of FMD, you usually, not always, but usually don't find genetic predisposing conditions. So in our practice, once we look for FMD in a patient with SCAD and identify it, we see that as the reason for the SCAD. As with other things about FMD, we don't know this to be true, but that is how we practice. And as of 2019, because there are very limited targeted therapies for any of these conditions, and because the therapies kind of converge to the same pathway of treatment, it doesn't really matter if we're right or wrong, but conceptually we think that is the reason. I will add one more thing. What that dictates is that when a patient presents with SCAD to one of our SCAD cardiologists, typically, they will typically try to image them from head to pelvis similarly to what we do, or similar to what we do with patients with known FMD. And the reason for that would be to look for those telltale signs on imaging that are typical of FMD or its complications.